Healthcare workers and those in the front line of the battle against COVID-19 are starting to receive their Johnson & Johnson vaccines. The Health Department Wednesday rolled out the vaccination program at a number of public hospitals. Now, apart from being cheaper than the alternatives, the Johnson & Johnson vaccine is a single dose compared to other vaccines. Head of the Emergency Centre at Khayelitsha Hospital, Dr. Sa'ad Lahri, joins us now to tell us more. He was vaccinated Wednesday. Doctor, thank you very much for your time. So you had your shot. How did it feel? Any side effects from a physical point of view? And then emotionally, how does it feel? Because you have been at the front line of fighting this virus for months, I'm sure.
Hi, Sally. Thank you so much for this opportunity. Yeah, no, I'm very excited. No side effects at all. I'm actually very humble, blessed, and grateful to have been given the opportunity to be vaccinated. You know, today is a day to be proudly South African. You know, it was our Tuma Mina moment, you know. So I hit the emergency center, and part of our role is to go first and then to be forward. And I needed to do that in order to show that the vaccine is safe. You know, the president asked for Tuma Mina, and we were there.
So how many people, do you know how many people at Khayelitsha Hospital were vaccinated on Wednesday?
Today, about 40 people got vaccinated in total.
And have you any idea how it's being prioritized? Because we know that there's limited amounts of the vaccine. So how is it decided who gets the vaccine first? Is it prioritized in terms of people who are likely most at risk?
Yes, so it's prioritized in terms of the healthcare workers that are most patient-facing, so those healthcare workers that are most at risk, those in the front line, and then afterwards those who are most at risk from their comorbidities. And
who makes that call?
So it's our hospital management. So everybody gets their allocation, everybody has a risk allocation, and then from there vaccines get allocated.
And how are you prioritizing? Would you say prioritize, let's say, two nurses who both work with patients, but one is older with comorbidities, one is younger and healthier? Would the older person with comorbidities be front of the queue?
Yes, she'd be in the front of the queue.
All right, so you're letting science and the risk of infection completely drive the process, and it's not made by the health department, but it's made at hospital level with the doctors.
Yes, together with the doctors and the nursing staff and our cleaners, porters, clerical staff. So there's equity across the board.
Well, that's really great to hear. So you've had the vaccination Wednesday. How long until you're safe?
So I'm hoping to be safe for forever.
What I'm saying is it going to take a week or 2 weeks or 3 weeks until it kicks in? How long does it take?
No, look, so basically the major issue with taking the vaccine is that we still have to wear your masks. You still have to socially distance.
Of course.
So we still have to follow all of those protocols. So the fact is we're hoping that we will be fully protected. But as you know, the vaccine's only got about a 57% efficacy. So we still have to carry on with our masks and social distancing and sanitizing.
Yes, of course. You have to observe all those important things we know. I'm just wondering what it has been like for you as head of emergency centre at Khayelitsha Hospital for the past year, coming through 2 waves of COVID-19. What it has been like in the past year, and against that context, what was it like to finally receive the vaccination?
You know, we've seen a lot of death and destruction and sadness and sorrow, and today was a proudly South African moment. Was a defining moment for us, because today we got an opportunity for another layer of defense. I've lost friends, we've lost family members, we've lost colleagues. I've got another close friend who's intubated and ventilated, who's a doctor in ICU. You know, people have risked everything. We come home and we put our families at risk. So today was a totally historical and defining moment. when I got that vaccine, you know, it was I felt very, very blessed, and I'm extremely grateful and honored to have received that vaccine. And I thank everybody who's played a part in getting that vaccine to us. And I urge all my health worker colleagues and the general public to please go out, play your part, be part of the Tumamina movement, and go and get your vaccine. We are all not safe until everybody vaccinates.
Absolutely. And I just want to thank you for all the good work that you and your colleagues have been doing over the months. It must have been extraordinarily difficult. And our thoughts and prayers are with your colleagues and people that you know, that all those in hospital tonight. We know that we're through the worst of the second wave, but there are still very many people suffering with COVID-19. And I just want to thank you so much for sharing that with us. And we wish you all strength for the months to come. Thank you.
Thank you.
That was head of the emergency centre at Khayelitsha Hospital, Dr. Sa'ad Lahri, and he received his vaccine on Wednesday, sharing with us what an important moment it was for him and his colleagues after such a very difficult period fighting this virus. Well, it's